Namaste. Welcome you all for the yoga session. In this session, we are going to do some headstands, that is Shirsasana. We are going to use a chair and 3 blankets. Sit upright, turn to your right side, hold it out of the chair, inhale, exhale, turn. Twist the trunk. These are all the basic movements. The twisting helps the muscles of the back. Breathe well. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Slowly come up. Change side. Hold it out of the chair, inhale, exhale, turn. And ensure that you fold the blankets neatly, arrange them nicely one on top of the other. You can use some 3 blankets. That kind of soft padding is essential. So twisting posture removes the stiffness in especially the lower back. Repeat. Sit to the right side, inhale, exhale, turn. This also helps the shoulder complex and turn the neck also in the direction of the twist, because in all these headstands, the role of the neck and the shoulders, also the complete arms, is quite crucial. Slowly come up, change side. Hold the top of the chair, inhale, exhale, turn. Turn the neck also in the direction of the twist. The shoulders and neck, they are highly interconnected. So as we go along in this session, we are also going to do some stretch for the arms, especially keeping in view the shoulder and the neck, so that the practice of these inverted postures becomes safe. Slowly come up. Sit upright. Stand up. Keep the chair on the blankets. We are going to do one simple half forward bend. Rest the wrists on top of the chair, walk backwards, stretching the spine, pull the kneecap, arms straight, relax the neck. Foot about 6 inches apart, pull the kneecap, roll the thighs in. The bending should be from the hip. So this is the hip flexion. The complete spinal column should be kept nearly parallel to the ground. Arms straight. Feel the armpit, feel the scapulae, stretch the elbows, keep on stretching the arms. In all the headstand postures, the role of the arms and the neck is very important. So these are some of the postures which do activate the system. Breathe well. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Be strong on both the legs. Legs should be perpendicular to the floor. Slowly get up, walk forward. Keep the chair about 2 to 3 feet away from the folded blankets. Ensure that the blankets are piled one on top of the other. Flex the knee, sit down on the heel. So adjust the distance between the blanket and the chair so that you can position the legs properly when you do. Lock the fingers, make a knuckle, join the base of the palm, grip properly, and place the knuckle and the elbows on the mat. Do not open the palm. The distance between the elbows should be equal to the shoulder width. Keep the head on the mat and lift the shoulders up. That's very, very important. Don't drop the shoulders. Then slowly, gently take the legs one after the other onto the seat of the chair. Keep the toes on the seat of the chair. Keep the legs straight. Spinal column nearly perpendicular to the ground. This is a simple inverted posture. So initially it is good to practice with a prop or support. Watch carefully the positioning of the head. You should keep the hind portion of the head on the folded blanket and rock the skull from the wrist. Press the elbow, lift the shoulders up. As you inhale, abdominal cavity should expand. As you exhale, it should contract. That is very important. As you may notice, the trunk is completely inverted. So the pelvic region, the abdominal region, they all see a reversal of the force they experience. Flex the knees, slowly come down, rest the forehead, relax the arms, just relax your breathing. So in the inverted posture, the organs in the pelvis and abdomen tend to move towards the diaphragm, that is towards the chest. They get a good relieving movement there. Slowly get up, keep the chair on the mat. We will talk about more of these inversions. Now we shall do one more stretch for the shoulders. Lie on your chest, keeping the chair in front. We shall do one nice stretch for the shoulder flexion. Rise both arms up, rest the wrist on the edge of the chair, press the palm on the seat, arms straight, relax the neck. Drop the forehead towards the floor. Keep on stretching the arms. Stretch the toes also back and squeeze the calf muscles. Breathe well. So this is a nice movement for the shoulder. There is shoulder flexion. The scapulae also move closer or glide closer to the spinal column. And when you drop the forehead towards the mat, it also acts as a good stretch for the muscles of the neck. Keep the legs also active. You have to spread the fingers, press the palm. Feel the stretch in the armpit. Flex the elbows slowly. Relax the arms. Relax the head and the neck. Slightly inch forward, rise both arms up, hold the top of the chair, arms straight, relax the neck. Here the degree of flexion increases because of the height. So feel the wrist. Feel your elbows, keep the elbows straight, feel the shoulder joint, feel the scapulae, the complete thoracic region, feel the chest, feel the neck, feel the stretch at the neck and the shoulders. Feel the complete abdominal cavity which is in flush with the mat. Feel the buttocks, both the legs. Tighten the calf muscles, stretch the toes. Breathe at ease. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. And in this posture, especially because of the abdominal cavity resting on the mat, you can see the expansion being quite pronounced in the posterior region, that is in and around the spinal column. So these stretches will further help the inverted postures, because in most of the inverted postures the role of the arms and the ability of the shoulder joints to take the load is important. Flex the arms, keep them down and relax. Neck muscles also get into some part of the loading. So doing these stretches with the inverted posture helps to relax the scapular system and the neck, and also makes the inverted postures better. Again, keep the chair behind the folded blankets. Flex the knee, sit down on the heel. Sit upright. Press the palm on the mat. Rest the head on the mat. Then take the legs onto the seat of the chair, toes resting. Keep both legs straight, pull the kneecap. Position the foot properly so that the complete trunk is nearly perpendicular. You have to take the elbows a little closer and the palms, the width, that the separation between the palms should be equal to the shoulder width, and keep the hind portion of the head on the mat. Keep the upper arms and lower arms active. Press the palm. Watch your breathing. As you inhale, abdominal cavity should expand. As you exhale, it should contract. By virtue of the gravity, the intestinal organs and the pelvic floor organs, they tend to move down. So that is a good relief for these muscles which always see a downward movement, as in when we are standing and sitting. Be strong on your arms, elbows closer. Press the palm. Relax your breathing. The positioning of the head is very important because it can minimize the loading on the cervical spine. So if it is wrongly kept, then the curvature at the cervical spine greatly alters and it could lead to problems. Flex the knee slowly, come down, relax the forehead on the mat. So this relaxation is important to normalize. Slowly get up. Keep the chair on the mat. We are going to do a side stretch. Lie down on your right side, stretch the right arm, below the chair. Right arm, trunk and the leg should be in the same plane. Now raise the right arm up, rest the right palm on the seat of the chair, right hand absolutely straight. Initially you can keep the left hand on the floor, and if you are comfortable you can stretch the left hand on the thigh. Right hand absolutely straight. So this also helps the shoulder joint as well as the arms. Breathe well. Slowly come down, change side. First lie down on your left side, stretch the left arm in line with the trunk and the legs, press the right palm on the floor. Initially you can have the support of the right hand, rise the left hand up, rest the left palm on the seat of the chair, rest at the edge of the seat. Left hand absolutely straight if possible. Take the right hand on top of the thigh. Activate the muscles of the left upper arm and forearm. Feel the wrist. Flex the left hand. Lie down on your chest and relax the arms. Inverted postures, the headstand done without supports, is called Shirsasana. Now turn to your right side again, press the left hand on the floor, raise your right hand, hold the top of the chair. If possible, rest the left hand on the thigh. Right hand absolutely straight. Ensure that the right hand, trunk and the legs are in the same plane. So that alignment is very, very important. So this side stretch helps the complete shoulder complex. And these headstands or Shirsasana, they are called the king of asanas. They have such an importance. They help almost all the vital systems that we have. Keep the left hand down, check out the right hand, then change side. Turn to your left side, press the right palm on the floor, raise your left hand, hold the top of the chair, align properly. If you are comfortable, you can rest the right hand on the thigh. Left hand absolutely straight. Ensure that the front leg of the chair do not get off. Feel the wrist, the muscles in the forearm and upper arm. Feel your elbow. The headstand is referred to as the king of asanas. It invigorates almost all the vital organs that we have. It's known to be good for the brain, the heart, the lungs, the intestinal and the pelvic organs. And when one can do without any of these props, it also enhances the neuromuscular coordination. But doing with props is a good, safe step. Slowly come down, Lie on your chest and relax. There are various ways in which one can take the support of the arms in going into the inverted posture. Slowly get up, and in this session we are going through some of these different ways in which one can do the headstand. Again, sit down, keeping the chair behind, sit on your heel. First we did with locking the palm. Next we did one by pressing the palm on the mat. And now we are going to the next variety. Fold the arms. From the hand, hold the upper arms. Keep the elbows on the mat. Rest the end portion of the head on the mat in front. Then lift the legs up. Toes on the chair. Keep the legs straight. Ensure that the trunk is nearly perpendicular to the floor. Watch your breathing. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Because of this inverted nature of the posture, lot of stagnation in the intricate organs of the pelvis and the abdomen. They will be removed because those organs tend to move towards the chest by virtue of gravity. And the blood flow helps the brain and also heart, the cardiac muscles. So initially it is good to do these postures with this kind of a support. All the organs of the upper extremities, ears, eyes, nose, they also get a benefit from these postures. Flex the knees, slowly come down, relax the arms, rest the forehead on the mat, and just relax. Relax your breathing. Slowly get up. Keep the chair on the mat. Sit upright. Sit at the edge of the seat, chest and navel up. Take the arms back, hold the seat of the chair, well up on the chest, roll the shoulders back. This is a nice shoulder extension. It helps to nicely open the top of the chest. Then take the chin towards the chest so that it gives a good passive traction kind of movement for the neck, thus relieving any strain on the neck muscles due to the inverted posture. Superimposing these kind of postures in practice of inverted postures does help the muscles which are likely to be strained, especially in the beginning phases of practice. Relax the arms. Now take the arms back, clasp the fingers, open the face of the palm, open the shoulders out, rest the wrist on the top rib of the chair, stretch the arms, open the palm, well open the chest. So this is another intense shoulder extension. Feel the shoulder joint, feel the scapular region. Feel the shoulder joints at the top of the chest. This movement also helps the muscles of the neck. Slowly take out the arms, relax. For Shirsasana, the health of the shoulder joints and the health of the cervical spine is very important. Take both hands back, hold the seat of the chair from both the hand, then take the hips down. If possible, cross the legs and sit upright. It's an excellent shoulder extension. Helps the shoulder complex, the upper and lower arms, also helps the elbows and does a great deal of good to the neck muscles. Once in a way you can take the chin to the chest to feel a better stretch for the muscles connecting the neck and the shoulder complex. You have to be seated upright. Both arms straight. You have to extend the elbows. Watch your breathing. Doing the inverted postures with varied configurations of the arms also help the stability of the shoulder joints. They also contribute to strengthening the shoulder and the neck. However, if you have a pre-existing problem, especially with the cervical spine, you have to be very careful in practicing these techniques. It has to be done in consultation with your doctor, and also it is advised that you practice under a competent teacher. Watch the shoulder joint, watch the shoulder blades, they glide closer to the spine and pull them slightly down. Now press the palms slowly. Get up, rest the hips on the seat of the chair and sit upright. Relax your arms. Slowly get up, keep the chair behind the blanket. Sit on your heel. Sit upright. We are trying to do one more headstand with a different positioning of the arms. On your knee, press the palm on the mat, rest the head, stretch the arms slightly sideways, slightly apart, press the palm facing the floor. Now keep the shoulders active, take the legs on to the seat of the chair, on your toes, pull the kneecap, legs straight, ensure that the trunk is nearly perpendicular to the floor. Watch your breathing. Note the position of the palm. Slightly wider than the shoulder width. Press the palm, keep both arms straight, but do not drop the shoulder region. And the back of the head should rest. That is the hind portion. On the top of the head. Hind does not mean back of the head. We are resting the top portion of the head, but there the focus should be on the hind portion. So if the loading comes too much forward, then the loading on the cervical region could lead to problems. Breathe well. As we inhale, abdominal cavity should expand. As we exhale, it should contract. The inverted postures rejuvenates the complete vital organs. Flex the knees, slowly come down. Relax the arms, rest the forehead on the mat. This simple resting forward bend is also essential to normalize the blood flow. As the palms slowly get up, sit on top of the chair, sit upright. Chest and navel up. Stretch your right hand forward, keeping it straight. Pull the right elbow, locking it from the left wrist. Pull it closer to the trunk. Turn the neck towards the right shoulder. This is a very good stretch for the deltoid muscles, which do play a crucial role in all the headstands. Feel the upper arm. Now relax the right hand, change, stretch your left hand from right hand, lock the left elbow and pull the arm closer to the trunk. Turn the neck towards the left shoulder. Left hand absolutely straight. Feel the upper arm especially closer to the shoulder joint. Breathe well. Relax the arms. Sit your right side, chest and navel up. From left hand hold it out of the chair, from right hand hold the seat of the chair, inhale, exhale, turn. Well, open the right shoulder. So this twisting not only helps the trunk and the neck but also the shoulder joint and the shoulder blades. Turn the neck also in the direction of the twist. Breathe well. Inhale, come up. Change side. Sit your left side. From right hand hold it out of the chair. From left hand hold the seat of the chair. Inhale, exhale, turn. Chest and navel up. It should be noted that the combination of twisting and inverted postures are very useful for the health of the intestinal organs. The twisting posture helps to squeeze these vital organs, thus removing the stagnation, improving the blood flow, and the inverted posture reverses the force field on these organs, thus giving them a great relief. Slowly come up. Sit upright. Keep the chair at an appropriate distance from the folded blanket. One more variety of headstand. Rest the palm on the mat, sit upright on your heel. We are going to slightly vary the position of the palm from what we did previously. So note that keeping the hind portion of the head means top of the head but slightly rearward. That's what you have to rest on the mat. Stretch both arms sideways, palm facing upwards, and then take the legs one after the other onto the seat of the chair, toes folded, pressed on the seat of the chair. Palms, the width should be slightly more than the shoulder width, arms straight, palms upward, but press the palm and keep the shoulders, upper arm active, and keep the trunk nearly perpendicular to the floor. Watch your breathing. As we inhale, abdominal cavity should expand. As we exhale, it should contract. So the inverted posture also helps in removal of toxins. watch your breathing. Ensure that the shoulders are kept active so that only a minimal portion of the load is transferred to the cervical spine. And this should be followed in all headstands. Neck should be loaded less. Maximum loading the shoulder complex has to handle. Legs straight, arms straight. Trunk perpendicular. Flex the knees, slowly come down, rest the forehead on the blanket, stretch the arms forward. These are some of the varieties of headstand. Of course, initially it is good to use a chair to get the feel of the posture. And also get benefited. And it also helps the neck and the shoulder joints to become stronger and better. Press the palms, slowly get up. Sit upright on the chair. From right hand, hold the seat of the chair. Right hand straight, slightly tilt the trunk to the left. Then tilt the head also sideways and then slightly move it forward so that you can get a nice stretch for the so-called SCM muscles in the neck. The neck greatly relaxes with this lateral stretch. Slowly come up. From left hand, hold the seat of the chair. Tilt the trunk to the right. Then tilt the neck and slightly move the neck forward so that you get a nice stretch. So this movement is a good stretch for the neck, because in all these headstands it's quite possible that these muscles get into some sort of a strain, especially in the beginning phases. Slowly come up. So these simple movements will help to relieve any such accumulated stress and strain. Now keep the chair close to the folded mat and note the orientation of the chair. And one of the blankets you can keep on the chair as a support for the back. Now first you have to sit on top of the chair, bend and go into the chair, the top rib, below the top rib. Slowly slide. Take the hand also out of the top rib. Slowly slide down and take the legs up. Rest the shoulders on the mat. Lock the chin to the chest. On the top of the chair, rest the foot and drop the knee, as in Baddha Konasana. The thigh is locked against the top rib or top frame of the chair. Arms sideways, palm facing upward, chin to the chest. Note the chin lock. So here the neck is in flexion, taking the chin to the chest. It's also a good stretch for the muscles of the neck. The shoulder joint should rest on the floor. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. In this posture, also you can see the reversal of the blood flow. This is also an inverted posture, but here we are taking the chin to the chest. In other words, the back of the head is rested instead of the top of the head, and there is this chin lock. So that's why these are all the derivatives of what we call as the shoulder stand or Sarvangasana. So this is with support we are doing. With the support of the chair we are doing Sarvangasana, and this rejuvenates the thyroid and parathyroid glands. The thyroid gland is called as the master gland because it has a significant influence on the performance of various other systems. A soft padding is essential so that you don't hurt the neck as well as the back. As you inhale, the abdomen and the bottommost portion of the abdomen, the pelvis, should expand. As you exhale, they should contract. As you inhale, the abdomen and pelvis should expand. As you exhale, you should contract them and slightly pull them down. So that will help to strengthen the pelvic floor muscles and organs. The urinary bladder, the uterus and ovaries in women, prostate in men, they all stand to benefit from the practice of this posture, because the opening of the knees provides a greater access to the pelvis. The abdominal organs do tend to rest on the diaphragm, which is a major muscle of breathing. Thus, they also help the diaphragm to become better. They also provide nice massaging effect for the cardiac region. The lungs also see the reversal of the force. The cardiac system also sees the reversal of the force because of gravity. This is in general true for all these inverted postures. So they do help these organs to become more adaptive and in general these inverted postures are known to boost the health of these vital organs. And in this posture especially, one can also adopt one more technique, or what we call as a bandha, a lock. As you exhale, toward the end of the exhalation, try to squeeze the urinary sphincters and anal sphincters and pull them slightly in, then release them. as an inhale. This can be done during some cycles of breathing to derive additional benefits. Slowly slide down, rest the back on the mat, legs on the chair, and just relax. Relax the complete back. Slowly get up, sit upright. Watch yourself internally. Namaste.